Mark, I'm Dr. Jason. Nice to meet you.
Nice to meet you.
Tell me what's going on.
Okay, back in 2006, I had a lumbar laminectomy.
Laminectomy, yes.
Laminectomy.
If you don't mind me asking, in 2006 you had this laminectomy. What kind of symptoms were you feeling and how long were you feeling that before?
And I was in a tractor all day and it was major vibration. And the next day or two, I fell to the floor and was there for a week. Injections into my back with the steroids, and came down to the conclusion that I'll go for an operation. I did go to the operation. It did not help, and so since then I've been to chiropractic, I've been to acupuncture, I've been to weightlifting, I've been, you name it, I was doing it, and everybody promised me something.
Right.
Of course. But it seems like I get in shape, I get stronger, and then I do something with a feather, and
Right.
it throws me down and out. And this time I don't want the down and out.
From what we do is really we try to find the underlying cause. Why is this happening? At least from a mechanical standpoint. It's good to get strong, but you have to get strong the right way to make sure that you're hitting those underlying points. So going back to your history, you're sitting in a tractor, that vibration, the fact that you're sitting on something that's vibrating it's destabilizing you. So if you're already unstable to start, then it kind of sets your body off into an inflammatory reaction, which could be potentially why it irritates the nerve going down your leg. So I think it's an underlying stability issue first, but I haven't watched you move and whatnot.
So even off the bat, you see how your shoulders are to the left of your body?
Yep.
So already that's going to torque on your spine a little bit. I'm going to lift this up a bit. This is to the left. Your pelvis is shifted a little bit here. Those are the main things that I'm seeing right now. Let's go feet together. As far as you feel comfortable, I want you to go down and touch your toes before any discomfort. Very good. Come back up. This time I want you to do it, but keep your knees straight. So go as far as you. There we go. Come back up. Let's go hands on the bottom of your waist. Bend back as far as you feel comfortable. Good. Hands on your side. You are going to side bend to your left as far as you can. Side bend to your right. Facing the front, I want you to turn to your right as far as you can. Very good. Turn to your left as far as you can. I want you to bring your feet shoulder width apart. As far as you feel comfortable, I want you to squat down and then come back up. Good. Come back up. And then just raise one leg up. Look straight first. I want you to close your eyes. Go on your right side. Do a little bend. See, it's a little more wobbly. Do you see that?
Yeah.
That may be one of the reasons why you get the sciatica symptoms on that right side, because it travels from your back down across your SI joint and the bottom of that, underneath those muscles. So, excellent. Go ahead, hold this leg for me. Right here, I'm just seeing how flexible your hip flexors are in front of your hip. I want you to turn to your right. Okay, turn to your left. Turn to your right. Turn to your left. Any discomfort with that?
Nope.
Relax here. Any discomfort with this?
Yeah, right here.
Okay. Same, better, or worse when I do this?
Same.
Okay.
Maybe a little worse.
Worse how?
Painful.
Painful more. You have much better range on this leg. So if I'm letting it drop here, I am rotating it. You get an idea of what that feels like. If I go to this side, first of all, I stop right there. If I let it fall here, you feel that pain. It's significantly higher.
Yep.
So How can we get that strength throughout so when you're squatting or you're standing on that leg, it's not collapsing? Because if your hip is collapsing, your back is collapsing. You can't have one and not the other, especially when you're standing. So definitely things we can look at. Again, my goal is, you're a strong dude. I'm just trying to find the imbalances within your body. So hold right here, breathe in, out. Don't let me move you. Pretty solid. I can feel your body does that. On this side, breathe in, out. Don't let me move you. Your body doesn't know what to do. It's like its reaction time is very, very different. So this one's harder. This whole side doesn't work. Breathe in, out. That one holds. Okay, so right now, in this pattern, you're able to hold your leg up on this side. You're able to stabilize, maybe pushing your legs this way. For some reason, this whole side is not working. We're gonna try to figure out why. Okay, that's the guy. When you get back pain or sciatica, do you have discomfort down here at all? Or is it just your leg?
Well, that's up.
Yeah.
It's just my back.
Okay. I want you to lie on your side for me. A little tender in there?
Yep.
So when you think about your body, it's a team of muscles working together to achieve a common goal. Think of the Lakers when they had Kobe. Kobe did too much and it didn't allow the other guys to do their job. If I'm right, that's Kobe, he's doing too much. I get Kobe to chill out. The other muscles should be able to turn on a little bit better. Is that too much? Or is it okay?
Yeah, well, you know. Grin and bear it, huh?
All right, just try to breathe. Yeah, this is right on lower lumbar, L3, L4, L5. That's right where your sciatic nerve runs out of. So usually when someone has sciatica, it's not just one culprit. It's usually trapped here. The fact that your body shifts to the left means your body's trying to stay away from it. It doesn't want to aggravate it. Does it feel a little bit more connected? Like you can hold it a little bit better?
Yeah.
Okay.
My leg.
Yes, perfect. That's what I want.
Not hitting you this.
Yes. It's basically getting this guy to chill out so you can actually use your freaking muscles. In my head, I think I'm on the right track. So you have this, it travels from your pelvis all the way up to your ribs. So if I get up to your ribs, I know it's not going to be fun. Because this whole part of your back does not move very much.
Okay. Yeah.
So have you ever found yourself when you freestyle, as you get tired, you're not able to rotate as much and open?
Yeah.
That's because if this core is not strong, you're not going to be able to open up here. So there's definitely things that we can do. I'm going like that hard.
Yeah.
Got you, Mark.
Got me.
I got you. So basically it's like, okay, how can we get your brain, your body, your neurological system to trust that your back is going to be okay? And it's you've been dealing with it for a long time, but hopefully with the right exercises, the right stretches, and the right hands-on stuff, we get it to let go. Out. Don't let me move you. Yes, exactly. You could not do that before. So imagine before, you have no way to stabilize here. You're balancing on this guy. It doesn't bring you back to your center. That's what we need. So now we can actually get exercises to get this to work. In a way, I kind of know what's going on here. Let's see if we can get this hip to move a little bit better. So right now you feel primarily, like if you let this fall down, you feel that pinching sensation. So you can rate that in your head, whatever you would like. You're gonna rest your arm here. I'm gonna go in a muscle that's deep underneath there, connects to your hip. If we get that to relax, hopefully you're able to go down a little bit farther. If it's too much, you let me know. I can feel it already. Yeah, I always ask, right? Because I think stretching is good if we can use our hands to make it, get the muscles to relax, to make it faster. That's, I work with professional athletes all day. That's all I do, get them to move better. I can do it. I can also show you ways to do it on your own. It may not be as effective, but if you can still do it as part of your program. I gotta start out gentle. I can't like jump too straight into it.
Yeah.
Part of why we do things the way that we do here is that it gives us time. Because if I were to jump straight in and like work this muscle, crack this area, your body may not be ready. Especially you've had years and years of discomfort. Your particular situation, you need to get this strong so this guy doesn't have to do all the work.
Right.
That's the difference. So that's the problem. Like you read internet, sciatic, what do? Do the stretch. But it may not be right for your body. My job is to figure out which category you're actually in. This muscle right here is the one I want you to use, and I'm going to teach you how to do it. So roll here, engage your abs just a little bit. The key is don't roll back. Okay, go ahead and lift your knee up. That guy. Lift. Do you figure piriformis now?
A little bit.
Okay. Let's go out there now. I'm going to look at you balance. We didn't do a crazy amount. I'm just trying to fine tune your body. Let's head out there. So stand. You can just keep eyes open. Pick up your right leg. That's what we want. So it starts with that balance. Then we teach you how to do different squat variations because you want to get stronger. But with the squat variations, it's making sure your form is correct and you're using the right muscles. Ideally, you get strong in this manner so you don't have these recurring events. If you do have a recurring event, it's of less intensity. We can never say we're going to wipe anything out, but that's always the hope because I used to throw my back out too. I lifted, I did these things. This is before physical therapy school. I'm just pushing weight because you want to, I feel good today. And you go home and then you pick up a pen and you're like, this is no good. So I've experienced it and I've worked with enough people where it's like, okay, maybe you have to dial it back, have these building blocks so you can actually do it correctly. Does this kind of make sense?
Yeah. No.
Basically, what I saw, we see all the time. It's just, you come with your own history. Your body is going to react a certain way because you've had 20 plus years of it versus someone that just happened, right? So the little hesitancy, the little skepticalisms about that, I don't blame you. I'd feel the same way if I were you. Cool?
Cool.
All right, man.
Thank you.
Nice meeting you.